All right, today we'll take a look at chapter 13 and we'll finish our lectures on the cardiovascular system. So we'll end with blood vessels. All right, so let's take a look. So let's take a look at the different kinds of blood vessels and what comprises the wall of the blood vessels, because that it varies in the composition of the layers that are around the blood vessels. So let's start with the first type of vessel, which is the artery. Now, we've already kind of defined a little bit about an artery, versus a vein, as far as how do we, what vessel do we call an artery? What do we call a vein? And it depends on the way the blood is flowing. If it's going to the heart, it's a vein. If it's away from the heart, it's an artery. Now we'll look at a little more detail. Okay, so arteries, as we mentioned, carries blood away from the heart, but there are different types of arteries. Okay, and I'm going to bring up a picture or some pictures of these different types. The first one are the elastic arteries. Now remember that these vessels, the arteries, are leaving the heart, so they're under high pressure. Okay. And those vessels that bring blood back to the heart, it's far away from the heart, the pump part of it. And so it will be under very low pressure. And because of that, we have different characteristics. So the first one is the elastic artery. And as it says, and the name says that it is has a lot more elastic fibers in it. This is the one closest to the heart. And because it's under such high pressure and we need the elastic fibers to allow it to expand a little. And what happens over time with, atherosclerosis, hardening of the arteries, is we lose the elastic fibers, or that ability for those vessels close to the heart to expand. All right. And so that results in hypertension, which is one reason for hypertension, which is because that vessel cannot expand or dilate to accommodate the pressure coming out of the heart. And so it's stiff, it's hardened, and so that blood pressure in there is much higher. The second type are elastic arteries, and the elastic arteries are next in line after the elastic arteries. Okay, and they have doesn't need as many elastic fibers, but they're still very muscular because the pressure is very high. All right, and notice that there is a muscle layer. Okay, there is muscle, smooth muscle that surrounds all these vessels. The last one are arterioles. Arterioles are the smallest of the arteries. They don't have a lot of the other layers, the other components that the first two have, but it pretty much is a layer of smooth muscle. Okay, so there's a lot of smooth muscle there, and blood pressure is actually regulated mainly through the arterioles because of the smooth muscle there. Okay, so when we constrict it, the blood pressure in the vessels gets higher. And when we relax it and allow that vessel to dilate, we can decrease blood pressure in it. So we can control blood pressure a little bit through the smooth muscle in the arterioles. All right. The next time, and I did say here, greatest resistance to blood flow. So by regulating that tunica media, which is the muscular layer, we can create a lot of resistance. Okay, as it's constricting, it creates resistance. All right, next. So remember the last time, maybe I should share that again. Just to remind you, Okay, that remember that the vessels are continuous. So we have blood coming from the heart, okay, high in pressure. And so let's say it's leaving through the systemic circuit. It comes out through arteries. So we would have elastic arteries, muscular arteries, then arterioles. And then after that, we make our way into the capillaries. So the capillaries, if you recall, are the area where we have exchange of materials because of certain properties, right? They have to be thin-walled in order for materials to easily move across. And this is where oxygen is taken out of the blood. Okay, and we get rid of some, carbon dioxide waste products. And then it makes its way through venules, which are small veins, to the veins, and then back to the heart. Okay, so that's the flow of blood, along these vessels. Back. All right, so now, next are the capillaries. Okay, and as I mentioned, they're thin-walled, and this is where the exchange of materials happen. Let me bring up a picture of a capillary. Okay, there's a little capillary. There's not a lot to it. They have the simple squamous epithelium, which we call the endothelium. So endothelium is the simple squamous epithelium. All right, and then we have a covering, okay, connective tissue covering. So we don't have smooth muscle there, and it's very thin, so it allows for exchange of materials. All right, lastly, we have the veins. I should put venules and veins. So carries blood toward the heart, venules, small veins. Okay, and as we're coming back, we go through the venules first, and then they become veins as they get bigger. And some of the bigger veins have valves to prevent backflow. Right, so let me bring up what that would look like. And not all the veins have it, but some of them do, especially in like the legs. You think of your legs where blood is going against gravity and it's far away from the heart. So the pressure to push it back up to the heart can be kind of tough, right? The pressure is lower and it's kind of tough to bring it back to the heart. So the blood will want to backflow or go backwards between beats, right? Between the squeezing of the heart, it will push it up. And then as it backflows, okay, as it comes backward, the valves will close and it will fill with, or so as it's coming this way, it will fill with blood and prevent blood from going backwards. Okay. All right. So veins have valves. Um, so what is like varicose veins in your legs? So this is where you get damage to the valves. And if there's damage to the valves, then the blood begins to pool. All right, so the blood pools in the legs, and yeah, and that's kind of unsightly. All right, the second part of that question is about the layers. Okay, and there are different layers. Oh yeah. Okay, we have we call them tunicas, which are layers. There's an internal one, the media, and the externa. Okay, so the tunica interna, as I've mentioned, but I didn't call it this, is the epithelial tissue, right? Simple squamous epithelium. namely called endothelium, which is the same thing. So there's an inner lining, which is epithelial tissue. The middle layer is the tunica media, and this is smooth muscle. Okay, so now we can give it a name. That middle layer, smooth muscle, is tunica media. And then externa, the outer part, is connective tissue. Okay, we call that the externa. All right. This next question about veins versus arteries. How do we tell the difference? And I've already kind of mentioned, the direction of blood flow. Arteries carry blood away from the heart, veins toward the heart. Um, because arteries are moving away from the heart, they're under higher pressure. And because of that, they have to have thicker, more muscular walls. So their tunica media is thicker, and because of the higher pressure. Okay. And interestingly, the arteries have a smaller diameter as far as the inside, the diameter smaller. The veins have a wider diameter, but they tend to be, since they're not as muscular, they tend to kind of collapse. They're more flat. So if you're looking in a cadaver, and because veins and arteries run side by side, right? There'll be a femoral artery, but then there'll be a femoral vein right next to it. How do you tell the difference? You could feel it. The femoral artery, because it's more muscular, it'll be like a tube, whereas the femoral vein, which is less muscular, will be more collapsible. You could kind of squish it a little bit, and it's usually a little wider diameter. Also, they're a little darker in color too. All right, now what do we do at the vessels? One of the things we do is we carry or we measure blood pressure. Okay, and when you take a person's blood pressure, you get two numbers, right? You get a higher number and you get a lower number. All right, these are called the systolic pressure and the diastolic pressure. The higher number is the systolic pressure, and it's the maximum pressure in the vessel when the ventricles are contracted. So you'll take your blood pressure here, at the brachial artery, there. All right, and so this is not as important to you because you're not doing clinical part where you're having to take blood pressures, but you will have to, look at results of tests and stuff like that, and blood pressure will be part of it. So the systolic pressure is the maximum pressure. Okay, so when the ventricles are contracted, it's squeezing blood out into the artery here, the brachial artery, and you're measuring it here. Okay, and that's the first number. Okay, the second number that you're measuring is the diastolic pressure. It's when the ventricles are relaxed. Okay, so you're taking two, but they're both the ventricles contracted and the ventricles relaxed. All right, and what you're doing is when you listen with the stethoscope and you're listening for sounds that depict when the vessel is open and closed. Because when you pump up the cuff, you're going to close off the vessel so there won't be any sound, right? So there's no sound here. But as the vessel slowly opens and blood starts moving through the vessel, you're going to hear sounds. And the first sound you hear is the systolic pressure. And a typical one, an average systolic pressure is 120 millimeters of mercury. So mmHg, that's millimeters of mercury. All right. And that it's when they measured blood pressure, they looked how many millimeters a column of mercury would rise in a tube. And that's how they measured blood pressure, and it kind of stuck. Now, we don't use mercury anymore for the most part, but it's still, that's the measurement, the units that we use. Okay, so 120 millimeters of mercury is a systolic and average systolic blood pressure. And then you'll continue listening and you'll hear sounds. And as soon as the sound disappear, it means that the blood vessel is completely open. And when a blood vessel is completely open, you don't hear sound anymore. And that would represent, when that sound disappears, is the diastolic pressure. And 80 millimeters of mercury is the average diastolic pressure. Okay, now, an increase in those numbers would indicate hypertension, high blood pressure, and a lower one has to be pretty low to be abnormal low blood pressure. And, what do you want for your blood pressure? A high one or a low one? You want a lower blood pressure, because the lower blood pressure means your heart doesn't have to work as much to get the blood around. All right, so those are the two numbers. So you would write, a blood pressure like 120 over 80, right? 120 millimeters of mercury over 80 millimeters of mercury, systolic, diastolic. Okay, this next one is to locate arteries on a diagram. In anatomy, this is a very challenging part of the class. And but it need not be. It is, because they're locating them on like a cadaver. And, when you look at a cadaver, everything kind of looks the same. And, but if you remember that the name of the blood vessel is trying to tell you something, okay, it's descriptive. It's going to tell you either where it's located, its region that you can find it in, or where it's going, where that blood vessel is supplying blood to. All right. So let's take a look at some of these vessels. We've done some of them. I'm going to bring up a big one. And let's go through these different vessels. Maybe I'll put this little guy, a little head here, so we can fit more stuff in. Okay, let's see how big I can make this. Okay, maybe I'm going to put all of them. I'll put all the vessels in, and then we'll go through and look at them. I'm going to make this a little bit. All right. And I got a couple more. All right. So let's go back to our list. We'll start with the pulmonary trunk. We've already done that, right? The pulmonary trunk, you look at two words. Pulmonary means lungs, breathing, right? Trunk means it's going to branch. So remember, in our heart diagram, where's my nice heart? All right, here we go. That the trunk here splits to become the arteries. So these are the pulmonary arteries that go this way and that way. But it begins as the pulmonary trunk as it leaves the right ventricle through the pulmonary semilunar valve, and the blood passes through the pulmonary trunk. Okay. Pulmonary arteries. This is the right one on this side, and this is the left one on this side. Okay. So pulmonary artery comes after the pulmonary trunk. Next, we have the aorta. Okay. So the aorta is this big one, right? But notice after the aorta, there are three branches that go to different parts of the body. They're going to go to the head, and they're going to go to the upper extremities, the arms. Okay. So the first one is the brachiocephalic trunk. Okay, so that's this first one. Now let's look at that name. Brachiocephalic trunk. It tells you a lot. Brachio, remember, it means arm. Cephalic means head. Okay, brachio means arm, and cephalic means head. And it's a trunk, which means it's going to split. So maybe, you know what? Let's draw. Let's draw. This is too hard to like just to point out where it is. All right. Okay, so let me look at my list here. Let's go from the aorta. So we have the aorta. And as I mentioned, there are three branches. And it arches, and it's going to go down through the thoracic cage and then into the abdomen. All right. This first branch, brachiocephalic trunk. So I know that it's going to branch again, right? Because it's a trunk. And in fact, it does branch into two different vessels. This first one is going up to the head. Well, here, let me label this. This is the brachiocephalic trunk. Okay. Hold on, let me make sure. Okay. And then the second one and the third one here are the branches off the trunk. This one's going to the arm. Okay. But before it gets to the brachial artery, which is down the line, it goes under the clavicle. So we call this the subclavian artery. Sub means under, clavian means clavicle. This one's going up to the head, but it's going up through the neck. So we call this one the common carotid artery. So this is the one that you take your pulse, your heart rate, okay, in your neck. You could feel it, pulsing because it's pretty close to the heart. All right. Common carotid artery and the subclavian artery. These are on the right side. So I'm going to put a right here. This next branch comes straight up like this, up to the head. So this is the left common carotid artery. All right. And then this one's going to branch like this and go under the clavicle. And this one's the left subclavian artery. Okay. I hope that makes sense. Okay. What happens after this? Now, the right and left sides are very similar after this, but before it, it's different. So let's follow one side here. Next, the vessel is going to come under the clavicle and then go into near the armpit. Okay. The armpit is the axilla. So we're going to call this the axillary artery. Okay, as it comes under, through the armpit and then to the arm. And then it becomes the brachial artery. Okay, and there's one on the right and there's one on the left. Well, what happens after that? At the elbow, it's going to split into two vessels, one along the thumb side. Okay, remember the thumb side is the radius side. Okay, I like to think of it's rad. So you give a thumbs up, it's rad. That's the radius side. Okay, so the thumb side, which is lateral, is the radial artery. And then the other side, the ulnar side, is the ulnar artery. Okay, and so those are the first of the vessels that you have to know. Okay, let's see. Let's go back now to our diagram. Okay, so let's follow it here. Here's the aorta. Here's the brachiocephalic trunk. Here's the right common carotid as it's coming up the neck. The right subclavian comes under the clavicle, into the armpit, the axillary, down the brachial artery. It's going to split into the radial artery and the ulnar artery. Okay, now from those, there's lots of little branches that come off of those. All right, because again, it's got to supply every cell in the body. So it's going to branch, 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 but we're just doing the major vessels. Okay, another view here would be this. We're looking at the brachiocephalic trunk here, and then how it splits into the common carotid artery. Well, that's going to split again into the internal and external carotids, and then go to the face. We get a facial artery here that comes around here, and then temporal, superficial temporal, and then comes in here. And right, so there we can go on and on and on. And so the thing you want to do is to understand what the name is trying to tell you. Okay. All right, and the subclavian comes around and goes under the clavicle. Next, let's go ahead and follow the aorta. We're going to follow the aorta down into the abdomen. Okay, now there are branches in the thoracic cage too, as the aorta comes down here. But let's follow it into this area. And the aorta, notice, comes all the way down through the middle of the abdomen. And then it's going to branch to each leg, each thigh, and then each leg. But there are some branches that I do want you to know off of the aorta. Okay, let's go ahead and go back here. So we're going to follow the aorta. The aorta is going to come down like this. And remember, we have the diaphragm here, and there's a hole in it through which the aorta passes. Okay, so this is the diaphragm. There is a G in diaphragm. All right, and so that's how the aorta passes into the abdomen. So now we're in the abdomen. There are lots of branches off of there. The first one is the celiac trunk. Okay, so remember, a trunk is going to tell us what? It's going to branch again. So this is the celiac trunk. And in fact, the celiac trunk is going to branch into 3 branches. One's going to go this way, one's going to go up like this, and one's going to go that way. And they're going to go to different parts. One goes to the stomach, one goes to the spleen, one goes to the liver. Okay, but it begins at the trunk. I'm not going to ask you to do those. The next branch, if we follow, is a pretty big vessel called the superior mesenteric artery. Okay, the mesentery is the kind of the peritoneum, the serous membrane and epithelium, the connective tissue too that surrounds all the intestines. Okay, so especially the small intestines, because it's 20 feet of tubing squashed in there, it has to be organized. And so there's this structure that surrounds it and keeps it organized, and this is called the mesentery. The mesentery contains branches off the superior mesenteric artery, which then is going to supply blood to the mesentery, but also to the small intestines as it goes in through the mesentery. All right, so superior mesenteric, which is going to the, well, maybe I should write here, superior mesenteric going to the intestines. Maybe I'll put small intestine. Celiac trunk is going to the stomach. to the spleen. And then this one's going to the this way over here to the liver. Okay. Next, we have branches going this way and that way. These are the renal arteries. And this is going to the kidneys. Renal means kidney. And the last branch off of here would be the inferior mesenteric artery. The inferior mesenteric goes to the intestines also, mainly the large intestines. Okay. And then we end, and it actually branches. All right. And it branches into, at the level of the ilium. Okay. So we have our hip here, hip bones here, this being the ilium. And so we call these iliacs. But, oops, but the first branch is called the common iliac artery. Okay, so it's near the ilium, the pelvis. And common works much like the word trunk. Okay, common means it's going to split, and it does split into two vessels, an internal and an external iliac. Let's see, do I have to? Oh, I just have you know the external iliac artery. There is an internal one there. And this vessel is going to pass through an opening called the inguinal canal. Okay. And as it passes through there, it's going to make its way out of the body cavity to your thigh. So this is called the femoral artery. Now, what do you notice? I see that the vessel is continuous. All right. It doesn't like end and then a new one begins. The blood vessels are all continuous. And it's like getting on the freeway and you're going someplace and you stay on the freeway, but the name of the freeway changes based on what city you're in, what area you're in, right? It's the same thing. You don't ever get off the freeway, but the name changes depending on where you are. Same with vessels. You don't ever get out of the vessel, all right? But the vessel changes as it, goes to different places. Right? So if it's near the femur, it's called the femoral. Okay. If it's by the hip bone, the ilium, it's the iliacs. Okay. But there's a common and an external. Okay. And an internal here. If it's going to the mesentery, which is the coverings around the organs in the abdominal pelvic cavity, it's a mesenteric, but there's one up here and then one down here, superior and inferior. Renal goes to kidneys. Okay. So try to make sense instead of memorizing it. Try to understand what the word means. And those are the arteries that you're responsible for. Let's take a look at, well, here, let's take a go back and look at the images. Okay, so this is nice. You can see them all coming down here, and then we split into the common iliac, then we get the external iliac, and then the femoral artery. Okay, and it continues, right? It's not going to stop, and they all have names, but that's where we're going to stop. All right, so we can, you can make this bigger and take a look at the different vessels, and this shows where they go, which is kind of nice. Stomach, spleen, liver here. So this is the liver on the right side. Here's the spleen on the left side, and the stomach is here. Here we have our intestines, right? Here's the three branches, the brachiocephalic trunk, the left common carotid, and the left subclavian, and then we have all those vessels. Okay, let's finish up with the veins. And let me bring up some pictures. There's some tricky ones in the veins. All right, let's see. Uh, All right, now with veins, there are some superficial veins, and you can see them right under your skin, right? There's a lot of veins that are just under the skin. And why don't we have arteries that are superficial? It's because arteries are under higher pressure, right? So you cut one of those and it spurts blood. So that's how you know if you cut an artery because it's under higher pressure, it's going to squirt. Okay, veins just ooze blood because it's under low pressure. So let's take a look. Maybe I'll draw some pictures too. Let me draw some pictures. So I don't know if it's easier or if it's worse. Okay, if it's worse, I apologize. Um, so let me look at my list. Okay, so we've done the superior inferior vena cava, right? So here's our heart. Right, we have the superior vena cava here, and then the inferior vena cava there, and they're both leading into the bringing blood to the right side, the right atrium. All right. Jugular. So I don't know if you know that the jugulars are in your neck also, and they run side by side with the common carotid artery. But the jugular is actually a wider vein because it's collapsible and it's wider. So if we look at our picture here, okay, we're going to have the internal, well, we're going to have a branch here, a small branch called the brachiocephalic vein. Okay. Um, and I don't think I put, oh, I did, brachiocephalic vein. So there's a left one and a right one here. From here, we have the internal jugular vein. Now, if there's an internal jugular, there has to be an external jugular, but I'm not going to have you learn the external. The external one is kind of next to it like this, and it goes to the outside of the head. And remember, blood is coming back to the heart, so blood is going this way and that way. Okay, back to the superior vena cava. So this is our superior. Vena cava. Okay, internal jugular vein, brachiocephalic vein. So this is also a brachiocephalic vein too. Okay. Um, let's see what's next. Internal jugular, brachiocephalic vein. I should label this also. So this is the right and this is the left. Okay. The superior inferior vena cava. All right. So, now realize that after this, we will still have a subclavian vein. We'll have an axillary vein. Which, runs side by side with the arteries. All right. And then we do have brachial veins. There's usually several. It usually kind of branches a little bit. Okay. But you don't need to know these. I didn't put that on our list, but know that they run side by side. But you do need to know some of these superficial veins that branch off of these vessels. All right, so first there is a superficial vein that branches off the kind of the subclavian here, like this. And then there's another one that comes on the internal side like this. All right, so these are superficial, and I'll make them look a little different. Okay. Maybe I'll underline the things you have to know. You have to know the brachiocephalic vein, internal jugular vein, superior vena cava, inferior vena cava. Okay, but you don't need to know these. Next, you do need to know this one and this one. This is called the cephalic vein, and this is called the basilic vein. All right. Cephalic vein, it's closer, like it's going toward the head, but not really. And basilic vein, I'm not quite sure why they call it the basilic vein. All right, but these are superficial. They're right under the skin. And at some point down here, they join together. There is a common vessel kind of between them. And again, these are all superficial. This one's important clinically. This is called the median cubital vein. And notice, on the right side, it's happening. I mean, on the left side, it's happening also. So I'm just doing one side. All right. So you do have to know the median cubital vein. This is where they draw blood from. Okay. So when you look here, right, where they draw blood is the median cubital vein, which is a superficial vein, near the elbow. Okay. Um, let's see, what else do you have to know? Okay. There's one more vein that you're responsible for, but I'll show you in the picture. Let me go back to our images. All right, so we can see here's the superior vena cava, here's the brachiocephalic trunk, here's the internal jugular vein. This is the external jugular vein, but you don't need to know that. And then we have the subclavian vein, the axillary vein, and then the brachial veins here. And then here, we could see the cephalic vein here on the outside. You can make these bigger in yours. And then on the inside is the basilic vein, and then joining them together is the median cubital vein. All right. All right, let's take a look here. I want to show you one more vessel. Now, the inferior vena cava also runs down the middle of the abdomen, but again, it's bringing blood from the lower extremities up back to the heart, right? And it runs side by side with the aorta. And then, there's branches here, the common iliac vein. We do have an internal iliac vein, which is right here, this little guy. And then the external iliac vein, which then passes out of the body cavity to become the femoral femoral vein. Okay. In the thigh and the leg, there is a superficial vein here that is just under the skin, and it's called the great saphenous vein. It's an amazing vein, and it runs the whole length, the medial side of the thigh and leg. Okay, remember the leg is from the knee to the ankle, and the thigh is here by the femur. So this big vein just kind of flops here in the medial side of the lower extremity. We call it the great saphenous vein. Okay, and that is the last of the veins that you're responsible for. All right, I hope that was helpful. Oh, let me make this a little picture. We can condense that a little bit. There we go. All right, and we have one more chapter left in this study guide. So thanks for joining, and I'll see you at the next lecture.